Two University of Oregon professors have been on the front lines of the coronavirus outbreak in Europe, based in northern Italy, which has been effectively locked down because of the virus.
That's right. And our Fox 12 Simon Gutierrez spoke with them on Skype today, and they're offering us some insight into what we can expect here in Oregon in the weeks to come.
Earlier this week, they wrote a letter to the University of Oregon urging a more proactive response to the virus here in Oregon, based on what they've experienced firsthand in Italy.
Why did you feel compelled to write that letter?
We were feeling very frustrated and worried. We see what's going on here in Italy, and it is an emergency situation, and I don't use that word lightly.
Melissa Grayboys is a professor of medical history, and her husband, Alfredo Burlando, a professor of economics. They're currently based in northern Italy and essentially confined to their home because of the coronavirus threat.
Supposedly you are allowed to go on short hikes and runs and walks as long as you are alone without anybody around you, and keeping a distance of 1 meter from each person that you encounter.
How is the access to food?
So supermarkets and pharmacies and parapharmacies are all staying open. Every other business is closed for the next 2 weeks.
In the days since their letter was sent, both the University of Oregon and Oregon State University have implemented social distancing measures and taken classes online for the first 3 weeks of spring term. Given their experience in Italy, where doctors discovered the first coronavirus case in late February, Grayboys thinks Oregonians should also take drastic measures.
If you have the possibility to work remotely, do it. If you have the possibility to call into meetings, do it. If you have the possibility of keeping your kids at home, in your home, now is the time to do it, because extreme social distancing is going to be most effective at the beginning stages of an epidemic, before there's large amounts of community transmission, before your hospitals are overwhelmed and it becomes a mandate.
It sounds like a silly thing because if you're really successful in preventing the disease, you will not see it. And so you might think that you've done something for nothing. But the reality, we see here what happens when those warnings, that social distancing doesn't take place right away, and that is an escalation. And now we're stuck at home. We cannot move from our house. This is not permanent. It's just a moment that we need to ride out. And if we can coordinate and do it all together, we'll all be better off.
Grayboys and Burlando said they don't think it's inevitable that the situation in the United States will mirror the one that they're seeing in Italy, but they also say that we shouldn't dismiss the possibility that it could. They say the most preventative measures we can take as a state now will pay dividends in the long run. Reporting in studio, Simon Gutierrez, Fox 12 Oregon.